The workshop is conducted by Department of Social Work, University of Kashmir, for the information of dignitaries, guests, and participants. The department is already running a course on counseling skills in the drug addiction. So this program is actually the offshoot of that particular course. The course has been initiated keeping in view the intensity of drug menace in the Kashmir J&K. The aim of the course had been to develop trained human resource which can help in tackling the drug menace that we are facing right now. Looking at the scenario of drug addiction in Kashmir, it's imperative that we may address the issue through early identification so that the mild level cases don't require long-term rehabilitation. We also need to look into two major aspects related to the problem of drug addiction. One is a trained human resource and another is infrastructure development. There's a need to develop both human resource and infrastructure. Thus, this workshop is definitely going to help in addressing this issue. At least it will be having an initiation from this particular workshop. The workshop is also unique in nature because it is targeting civil society organizations who have a very important role at grassroots level. With the aim to develop the capacity of civil society organizations, we are supposed to engage the diverse range of resource persons from different backgrounds like from psychiatry, psychology, medicine, sociology, social work.
We are thankful to all the dignitaries on the dais and all the participants from various civil society organizations who have joined us students and scholars from different departments and our department. For the kind information of the worthy director, that the Department of Social Work has started a program on counseling skills on drug de-addiction. And the first batch of this course have already passed and it has been carried on under Rashtriya Uchitar Shiksha Abhiyan and it has been there and first batch, as I said, has already moved past and they are doing good job in various welfare organizations. In fact, they have also joined some government departments as well. And we all know that we, conduct many skill development programs which are targeting livelihood, which are targeting, where we generate income. But there are very limited programs which are service-oriented, which offer services to the society, which bring reformation to the society. And one of such program, which is skill-oriented, has been this counseling program in drug de-addiction. As we all know that, the substance abuse is a concern. There is no doubt about that. When we send students to field, when we, collaborate with various institutions, whether it's the Institute of Mental Health, Neuroscience, government hospitals, psychiatry hospitals, police, director of police for various field works, the response and the feedback which comes from our students is that it's a very serious concern. And students who just, when they experience this training at these agencies, they have different perspective, they have different understanding. And we have a data. It's not like, we have facts. When we see the drug policy, it is uploaded in the website, see the data. We have some independent studies. We have some studies by international organizations as well, which reveals that, there is a concern and we need to address this issue. And it was in this context, our Honorable Vice Chancellor and widely encouraged and cooperated by our worthy registrar that this responsibility was entrusted to our department, and Alhamdulillah, we have tried our best to translate this into real sense and benefit the society as a whole. My dear friends and students and scholars, society has changed. There's no doubt about that. We are not having the same family. We don't have the same society. Everyone is busy. Families, social institutions have changed, social structure has changed. In such a situation, even the social policing which we were, talking about, the social control is no more. I remember the previous workshop which we have had. And one of the experienced and worthy professor said, he said, when I had to smoke this cigarette, I used to go to next mohalla because I was very scared and afraid that nobody should see me in my own native place, in my own mohalla. Perhaps that was the respect, that was the honor, and that was the fear and the social control, the informal social control we have had. And that is no more today because of huge change which has taken place in the society. And that demands that we need to work. We need really look into this aspect. And we already have a call, Nasha Mukt Bharat, isn't it? There's a program there, and there's a toll-free number as well. And today's program, the civil society organizations, we have observed that they have an amazing role. They have a tremendous role. They work very closely with the community. They work very closely with the society. They work in the villages. They work in the far-flung areas. They have a good rapport. They have good trust. They can screen. And it's just a matter that how we can build their capacities, how we can enhance their potential. And with that intention, that we can have better referral services, we can identify them and send them. Because I have seen that Director of Health Services, they have launched district-wise, anti-addiction centers where we have counselors, the psychiatrists as well. But it's a matter of how we aware ourselves, identify the symptoms, and refer them. And today, in that context, we have organized these 2-day programs. If you go through this agenda of the program, it's a mix of psychiatrists, psychologists, clinical psychologists, social workers, legal lawyers, and everything, so that we have a holistic understanding and help us, to overcome this problem, which is very significant, and we cannot, move away from this. It is our responsibility as a member of a higher education institution, as a member of the civil society, and a member of this society.
It's my pleasure, on behalf of Department of Social Work, I welcome the guests for today's function. The function is a 2-day workshop on civil society organization, on the identification and referral services for substance abuse. I extend a warm welcome to our Dean Research, University of Kashmir, Professor Irshad Ahmed Navju Saab. In spite of the busy schedule, he rescheduled many meetings to be a part of this important event. Thank you very much, sir, for coming here. I extend a warm welcome to Registrar University of Kashmir, Dr. Nisar Ahmed Mir, whom we at the Department of Social Work feel they are a part of a social work fraternity. Thank you, sir, for coming here. I would like to thank Director Health Services, Dr. Mushtaq Ahmed Rathir Saab, for accepting our invitation in spite of his busy schedule. Thank you very much, sir, for coming here. I would like to welcome Mr. Alford, who has traveled long to come here. He's an independent consultant, has been working on community psychosocial issues, and it's a privilege for us that we have Alfred with us here, and he is teaching the drug addiction students a lot, and I can see that students are interacting and they are learning a lot. Thank you very much. A warm welcome goes to all the resource persons who have come from different civil society organizations, participants, students, scholars, faculty members, and the non-teaching staff of our department. Thank you very much. It has been a continuous endeavor at the Department of Social Work to kind of create the bond with many civil society organizations, and we believe that Department of Social Work, we cannot work in vacuum and in cocoon. We need to interact and have close bonds. And today's function, it's a kind of a collaboration where we would like to see what the civil society organizations are doing and what kind of things they are experiencing. And we have got many resource persons who will be guiding and kind of giving them hands-on training how to improve the performance.
Basically, as Registrar or as Vice Chancellor, University of Kashmir, Professor Talat Saab is also, we always wish that the research which is being carried in the University of Kashmir, that is good. The teaching which is doing in the University of Kashmir, that is again good. But the extension work which we need to do as a responsible institution, because this is the oldest institution in J&K. We have been established in 1948 and we have almost completed 7 decades travel in the academics. So a lot of responsibility lies on the shoulders of University of Kashmir, particularly when it comes to the extension, education, or what we give to the society in return. Students are good, researchers are good, and doing research is also good. What Shazia was speaking that we have now thrust on the action research. Yeah. What the society is confronting, different social issues, those are different social problems which we confront at present because of certain global changes, certain changes at the national level, certain changes at the UT level. We are facing some issues which are very disastrous. Particularly the today's event, which is regarding the drug addiction or drug de-addiction or drug abuse, substance abuse, whatever you may call it. And what we have earlier also listened from our experts in this department only, that how the drug abusers have now taken the vitals of our society. So we have to be very cautious and we have to train our resources to confront this menace. I'm happy that under RUSA I was very curious to start any course which will help in particularly to develop a human resource which will slightly help our extension centers, particularly health, education, NGOs or other organizations which will help them in day-to-day activities in counseling such students or such abusers. And Alhamdulillah, Department of Social Work has been able to complete its first batch, and they are going to have now second batch. My request to the students and scholars of the university, particularly the Department of Social Work, is that we should involve ourselves. If we teach or if we make one person to get rid of the drugs or get rid of the abuse, any sort of abuse, I hope that when we say that if you plant a tree, you serve the universe. Same way, if you are able to help one person who is involved in it, I hope that you are helping all. Because when we say the addiction at any level, if particularly at family level, we see that whole family gets devastated, particularly the parents, the sisters, the brothers get devastated in a family. So my request will be that you will do your job good. From the University of Kashmir, we will always be strengthening and we will giving our full support to any such department which will help us in doing some noble services, particularly at the extension activity level.
It was a dream project of our Honorable Pradhan Mantri under Nasha Mukt Bharat. Total 272 districts were identified, and out of them, only 10 districts they established throughout India ATFs, but we have established 5 among them, among those 10 ATF centers. Drug abuse is a major health problem and menace in J&K. As per the latest scientific studies, around 2% of general population is affected by this problem in Kashmir division. Majority of which is affected by opioid use disorders, opioid consumption, poppy derivatives, opium, codeine, and others. Alcohol use in rest of the India, alcohol is the first one. In recent years, there is a shift from oral intake to opioids, to intravenous use of opioids in Kashmir Valley, and also a shift from weaker opioid like codeine, Fuki to harder opioids like IV heroin, and we have seen lot of deaths due to overdose. And they are more susceptible to infectious disease such as hepatitis B and hepatitis C and HIV. Studies from these addiction treatment facilities point towards high prevalence of comorbid hepatitis C of around 20% of IV heroin abusers. And hepatitis C is becoming very like AIDS in our Kashmir Valley. Directorate of Health Services Kashmir is conducting first time in Kashmir. We are conducting 10 district substance users prevalence survey at present in collaboration with NIMHANS and this AIMS Delhi. This survey will be major and comprehensive study of substance use pattern in all 10 districts of Kashmir division. 1,500 individual substance abusers were interviewed for this survey, which is unprecedented in such studies. This survey will help us find the associated factors of substance use disorders. The survey is in analysis phase and more than 100 variables associated with substance use will be assessed. Comprehensive and detailed report will be released on 26th of June. That's the International Day Against Substance Use and Illicit Trafficking.
As has been pointed out by all the members so far, that the major concern at present throughout the world is of addiction. Even though I am from a different field, I am from biological sciences, but Shahzabiti will understand, I have been working on different themes, and one of the themes is mismanagement of consumption of drugs. When you talk about addiction, people try to use different themes, but if we look at Valley of Kashmir, my vision is altogether different. Every family and every family member considers himself or herself as a doctor. They on their own try to consume drugs without bothering about the impact of consumption of drug, without consulting a physician. And the quantity of consumption, timing of consumption, and the impact of that is never assessed by either the parents or by the kids themselves. Reason being that in Kashmir, in almost all the markets, medical shops are providing us medicine without even bothering to look at the prescription. You can purchase any medicine from any shop without depicting or showing them the prescription. Go to any shop outside J&K, we have to show them the prescription, even for purchasing a paracetamol. In Kashmir, you can purchase any antibiotic on your own without quoting a reference of any prescription of a doctor. Similarly, the quantity of consumption, we never bother about what is the recommendation of the doctor. They give us a pattern, either one in the morning or one in the evening, or once, one tablet or one capsule every day, or after a duration of 4 hours or 5 hours. But we consume a medicine and then after half an hour or so feel there is no impact, and we try to reconsume the same tablet again and again. And addiction, on the basis of what we have experimented, is that if a medicine is consumed and it remains within the circulatory system of the body prior to consumption of other tablet or other syrup, it seems to accumulate gradually in the body, and that develops addiction. I'll quote 2 examples. You might have heard a name of Papaver somniferum, opium poppy. It is considered to be the basic source of morphine, which has saved millions of lives during World War I and World War II. And at present, this is one of the major narcotics consumed by almost all the drug addicts, where the cost of 1 kg is more than 1 crore rupees. Cost of 1 kg of morphine is more than 1 crore rupee. Even though all of us consume the seed of that particular fruit from which this morphine is extracted every day with any bread that we consume. Khashkash jisko hum bolte hain Kashmir. This is the seed. But at the green stage, if we incise that fruit, white color latex comes out. They collect that latex, store that, subject that to processing, and trade that as a drug. That is basically the morphine drug. In World War I and II, whatever injuries of soldiers sustained, they were actually prescribed this, but gradually they also became addicts. Similarly, cannabis, hemp jisko bolte hain, charas, ganja वगैरह जिसमें से निकलता है, that in my knowledge, botanically is one of the important sources of a fiber. We call that as hemp fiber. We can use that to weave cloths that we wear. But we use the same plant to prepare 3 different types of beverages, narcotics, charas, ganja. And this is again showing that we are misusing what our knowledge is. And addiction is primarily based on the fact that we have never bothered to consult a physician, a doctor, as to what is the medicine that I should consume, what is the pattern I should use, and what is the quantity that I should consume. Pain relaxants are consumed by almost everybody just after suffering minor pain. And if the impact is good, next time without having major pain, they try to consume the same drug and they become addicts. And just to give you some examples of our culture, हम चाय पीते नमकीन चाय, बिटिया यहाँ पे बहुत सारी है. For how long do we boil that foliage of Camellia sinensis, that is the tea plant? Do you know what is the impact of that? It's a carcinogenic plant because the caffeine content that oozes out from that leaf, if we boil it for longer duration, causes carcinoma. Even though that caffeine is a stimulant. It stimulates our body system as a whole. We consider that coffee is more harmful as compared to tea. That's a misconcept. Coffee may be bitter because we roast the beans of coffee. That's why it is bitter. Even though caffeine content in coffee beans is much lower as compared to tea leaves. In tea it is around 4.1%. In coffee it is about 2.7%. And imagine our misconceptions. We consume boiling the tea for hours together and then consume the same cup of tea. And that makes us addicts. And subsequently, we find that digestive absorptive systems, Dr. Sahib will bear me out that in majority of the Kashmiri patients, the digestive absorptive systems are suffering from carcinoma. Similarly, spices and condiments, all the BTS will bear me out. The quantity that we use, recommendation is एक इलायची छोटी सी दालचीनी का टुकड़ा और इसी तरह बड़ी इलायची थोड़ा सा डालेंगे. Imagine how much we consume. चार इलायचियाँ डालते हैं, बड़ी इलायची 2-3 डालते हैं, and imagine what oozes out from those during boiling. And that in turn is causing in us an addiction of those spices, and all those spices are becoming carcinogenic agents in our digestive absorptive systems. I worked on these things because I have certain projects on these. Saffron. Saffron is considered to be one of the best remedies for chest and nasal infections. But imagine the quantity that we consume, and imagine the way we consume it. जब हमको कहवा बनाते हैं उसमें हम बॉयल करते रहते हैं for hours together. Recommendation is to keep it in water for half an hour or so and add that extract to that particular beverage. Flavor and taste and color will be wonderful and there will be no side effects. But we boil it, and during that boiling, huge quantity of those components come out and we consume those, which in turn actually causes in us an addiction of that type of kava or that type of sweet dish. And that in turn affects negatively our digestive absorptive systems. As Dr. rightly pointed out, carcinoma is one of the major impacts of such consumption patterns. So I hope during these deliberations today, all the people who are trying to advise us would try to highlight that what is the ways and means of protecting addiction or whatever normal consumption patterns are. Especially Kashmir में cultural aspect जो है, spices, condiments of huge quantity में खाते हैं, we can avoid that. And similarly, हर एक घर में everybody is a doctor himself or herself, and they recommend medicine on their own without worrying about the side effects. So my advice to all will be that try to listen to what the deliberation would be and what the suggestion would be, so that each one of you can understand exactly how we on our own can be able to control this addiction phenomenon.